We begin our show in the state of New York. The epicenter of America's coronavirus crisis reported a single-day fatality record on Wednesday with 779 deaths, breaking the record set just a day ago. The total confirmed cases in New York State approached 150,000 on Wednesday, with the whole nation reporting nearly 430,000. Officials warn Americans to expect worse numbers this week. But there are also encouraging signs, as numbers including the daily hospital admissions and intubations are down in New York State. Media reports did say that frontline healthcare workers in New York City, though, still lack protective equipment, and some are experiencing symptoms without getting tested. So what's the situation really on the ground in New York? For answers, I spoke to Penny Abeyewardena, the New York City's Commissioner for International Affairs. Let's listen in. Tell me more about the latest situation in the city of New York. I know a lot of challenges every day.
That is unfortunately an understatement. The situation is very dire in New York City. We are the epicenter of COVID-19 right now. We are working very closely with our state leadership, with Governor Cuomo, and under Mayor de Blasio's leadership, we are really trying to tackle the extraordinary numbers we are reaching here in New York City. It's almost exponential every couple of days. So it is a very dire situation right now in New York City.
Talking about the exponential number, how are the ICUs and emergencies of hospitals dealing with it? How are the sources of private and public hospitals being put together?
Yeah, you know, we have a very robust healthcare system right now, and they are heavily burdened. I will say, you know, through the work of my agency and in partnership with other city agencies, we are actively trying to recruit both medical personnel, but also get the PPE and the ventilators we need. We are running out of supplies, and it has been very important that we get the surgical masks, the N95 masks, the gowns that we need to protect our medical personnel. But the public and private hospitals are working together. We had 20,000 hospital beds. We are increasing it to 60,000. We need to increase it to 60,000 hospital beds, and we have had private sector partners like the Javits Center, the U.S. Tennis Association give their center in Queens to be able to create field hospitals, and that has been very important to add to the robustness of our hospital systems to provide the medical bed and care that New Yorkers need right now.
You talk about the earlier experience of your city trying to deal with such a quote-unquote war, as you earlier indicated. But sometimes it is with very limited resources. And also it is due to certain kinds of structural issue that you have to face when it comes to government. So tell me more about how, at the very beginning, the relationship between the city of New York, the state of New York, and the federal government, and what is going on now. Are some of the problems really solved systematically?
You know, the U.S. has you know, our federal system, but we've always had a very strong working relationship with Albany, with Governor Cuomo. The relationship between city and state is extremely important. I think politically, we've had some challenges with the Trump administration on issues related, for example, to climate change. You know, as the Trump administration pulled out of the Paris Climate Agreement, New York City was the first city that committed directly to it. Now over 420 U.S. cities are committed directly to the Paris Climate Accord. But at the end of the day, we are one unit. We are you know, Americans, and so the relationship that the mayor has with the governor and with the president right now, it is about addressing COVID-19 and protecting New Yorkers and ensuring that we are able to, you know, mitigate this crisis as it is happening.
On the other hand, you know very well there is a competition going on worldwide about procurement of medical supplies. So how is New York trying to do its part? What about that competition? And also, is federal level going to be any help to the city?
The mayor has a working relationship with President Trump and the administration. He speaks to them frequently. They have recently given quite a lot of PPE and some ventilators that we've needed. But we've also seen, and this is something that we have been working on for many years, but we've really seen the coherence of subnational leadership coming together and supporting each other. So the governors of Oregon, Washington, and California are loaning New York City ventilators. This is really something statewide that we're in together.
At this moment, when the pandemic and New York being the epicenter of it right now, there are also likely to be other challenges, Ms. Commissioner. If I understand right, there are reductions of budget in certain areas of New York City as a result of the overall budget cut for the city. How are you coping with all of these battlegrounds, in a way, at the same time?
Yeah, I mean, that's a great question. Mayor de Blasio and the administration had been very careful over the last few years in terms of our budget surplus, and so we were ready to take this on. These are some of the realities we're going to have to deal with as this pandemic goes on. Taxes in the U.S. have been pushed until midsummer, so cities and states aren't going to get the revenue that they have, and there is going to be a budget crisis. But right now, we are able to manage with what we have. We are also very determined to ensure that our school system, which has gone online for 1.1 million kids throughout our 5 boroughs, is functioning and is a strong source of education for our young people. We are focused on our food supply chain and ensuring that all New Yorkers have food and don't go hungry.
Yes.
The mayor recently announced Catherine Garcia, who's our Commissioner for Sanitation, as our food czar. So I believe that our priorities are all in the right place right now. Some of the questions that you're asking about long-term planning, we're both thinking about right now, and we'll share those plans. But really, this is very much about dealing, as the mayor says, we are in a war right now,
Yes.
and so we are waging this battle as it is happening to us right now, and it has been extraordinary to get the support of not only New Yorkers around our 5 boroughs really pitching in where and how they can, but honestly, the international community has just heard our call for support and have been doing that at exponential levels, which has been amazing.
When the crisis is going on in the city of New York, many around the world are trying to lend a helping hand. While at the same time, people are also expecting the city of New York to be responsible and also helpful for people in that city from various backgrounds from all over the world. Let's listen to the next part of our interview.
We are host to the largest diplomatic corps in the world.
Indeed.
I have been in touch and I have been in touch with my colleagues throughout different missions, including your Chinese ambassador to the UN and the Consul General of China. The city of Shanghai gave us a really generous donation of K95 masks, but we've also had other governments like Qatar make significant donations. The United Nations gave a historic donation of 250,000 surgical masks from their own stockpile on UN headquarters campus. So we have really seen the international community not only reach out to us to show their solidarity, but really give and donate to the community that has been serving them from a diplomatic perspective for decades. So we are seeing the global community come together and support us. And it really is extraordinary what is happening on the ground in New York City right now.
Ms. Commissioner, it is no coincidence that in pandemic or in crisis, people will see sometimes the rise of finger pointing and racial discrimination. For a city like New York, which is a very international and diverse one, you yourself is coming from maybe a family of various sources, right, of different cultures. So how are you dealing with that? How to avoid this thing spoil out of control, particularly when you have some of the federal officials making remarks that's not very helpful?
The issue of discrimination and harassment has been something that we have been addressing since the beginning of this crisis. We have a Commission on Human Rights, which we are we have an absolute policy against any harassment or discrimination based on perceived notions of where this virus came from, and just, discrimination against the Asian communities. We have services. We are prosecuting any sort of harassment around this. We are ensuring that New Yorkers have the tools necessary to ensure that they know who to talk to and who to call if they are feeling harassment or any sort of fear based on this sort of racial discrimination. The most important number for New Yorkers to know is 311. If there are any concerns related to discrimination and other types of harassment, if they call 311, they will be directed to our Commission on Human Rights to ensure that they get the necessary legal and other support that the city is providing. I also want to share that mental health is going to be a significant challenge as people are having to shelter in place and stay at home. And we have a very robust mental health program called Thrive. This has been a priority of Mayor de Blasio and the First Lady Charlene McCray since 2014, quite honestly.
911 probably was the latest, the biggest disaster people could recall about the New York City, but now this pandemic being the epicenter of it. So what do you think, even out of your own personal experience, what have you learned through the experiences of going through the crisis like these? And what does it mean for you personally? What does it mean for your relationship with your beloved ones? What does it mean for your relationship with your beloved city?
Yeah, that's it's a great question, because we've not only survived 9/11 recently, we've also survived Superstorm Sandy. So New Yorkers have gone through a lot, and what I will say that I've learned is that we have extraordinary resilience, and I also like to think that we learn from these experiences. Not only is there resilience of New Yorkers, but we're also learning, lessons where we need to strengthen our health systems. Right now, something that we're going through in New York City and throughout the U.S. is our census. And something that's very important about our census is that this is how the federal government allocates money for healthcare systems, for education, for infrastructure like roads. And so right now, while everybody is sitting at home, I hope they will take the census, because all of us need to be counted. If we're counted, we get the money that is needed to build the infrastructure that we need to thrive. And so I think all of this is going to end up, personally, it just makes me love New York City even more. I am right now currently sitting in the middle of the epicenter. I'm on the Upper West Side in Manhattan, and I hear ambulances all day, and I'm talking to people and trying to ensure that we are getting the support that we can get from the international community. I have colleagues throughout city government that are doing everything that they can to protect our community and address this pandemic. And quite honestly, that just makes me proud to be a New Yorker. It makes me proud to be an American, and we're going to come out of this stronger than we were before.